Hi, Miss Rowland. My name is Zelnetta. I'm your nurse for this shift. I'm here today to do an assessment on you and to check and see how you're doing. Are you having any pain or discomfort at this time? No, ma'am. Can you tell me why you're in the hospital for back pain? How is your pain right now? Zero. That's very good. Okay. I'm going to explain to you what I'm going to do. We're going to check your blood pressure, your pulse, your heart rate, your lung sounds, and your different pulses from in your neck, your wrist, and the side of each arms, bilateral, popliteal, and great saphenous to make sure you have good tissue perfusion. I'm going to perform a skin turger, and that's when I'm going to pinch you slightly, but not to hurt you, to see how quickly your skin goes back into place. I'm going to press on each finger to see if capillary refill to make sure everything is fine as far as your blood flow. Okay? Okay. All right. Let's begin. I'll sanitize my hands before touching the patient. So to make sure that I'm not cross-contaminating or giving her any unwanted germs. First, I'll start off by identifying her correctly. Miss Rowland, can I see your armband, please? Thank you. I'm going to cross-reference it to my computer to make sure that the armband and everything matches. And it does. Can you tell me your date of birth? May 22nd. And your full name? Deanna Rowland. I do that in order to do another identification and to see her alertness, if she's aware of what I'm saying, and to make sure that she can communicate and hear me. First of all, we're going to check your blood pressure. Is that okay? It's okay. Is this arm okay to do your pressure? Yes, ma'am. I asked that question just in case she has some type of restriction. I don't see any restrictions on the wall. She doesn't have any armband restriction, but I still ask that question to be on the safe side. Want to do your blood pressure? Thank you very much. Relax, please. I tell the patient to relax because I don't want them to feel stressed because that can affect their blood pressure. I place the stethoscope at her brachial artery and I watch as I pump the cuff. What I'm looking for is for the needle to stop moving, and then I know that it tells me that I can stop pumping the cuff. I stop, then I open up the valve slowly until I hear her pulses come back, her brachial pulse come back. And I watch the needle go up and go down until it finally slows down to, and then I have her blood pressure. Your blood pressure is 160 over 72. Let me take that again to be certain. We always do a second blood pressure before we, come to alarm. It might have been a mistake. But before I do the second blood pressure, I give her time to recuperate. Okay, that's a lot better. Your blood pressure is 120 over 65. And this. Put your arm, please. Thank you. Because this is her private room, I don't have to worry about providing privacy. The door is closed. I'm going to take your temperature. Can you open your mouth, please? Under your tongue. And just relax. While her temperature is being taken, I can watch the rise and fall of her chest to see if it's if she's breathing evenly, if she's breathing labored, is she using her stomach to breathe, or is she just relying on her diaphragm? and she has a good even blood heart of respirations, non-labored. Okay. Temperature's done. Your temperature is 97.6. That's within normal limits. Okay, the next thing we're going to do, we're going to check your heart rates. By checking your heart rate, we're going to start with the apical pulse. I'm going to place the stethoscope at the base of your heart, and I have to unbutton your blouse. Is that okay?
Yes, ma'am.
Okay. Prefer to do a skin-to-skin assessment so we can hear without any distortion. I take an apical pulse for 1 minute. Okay. Everything sounds good. You have a regular rate and rhythm. After I've taken her apical pulse, I make sure that I button her pajamas back. Okay, ma'am, can you sit up so I can listen to your lungs? Is that okay?
That's okay.
Once again, I'm going to go to the patient's skin. Is it okay, ma'am?
Yes, ma'am.
Always checking to make sure it's okay. We're going to start at the bottom of the lung. I'm going to have her breathe in her mouth and out her nose. Take a deep breath. I'm listening for sounds. Make sure that it's no wheezing, no stridor, no labor. Go to the next side and do the same. Take a deep breath. Then we're going to go up. Check the lower lungs first and the upper. Okay, our lung sounds are good bilateral. You lay back. Now I'm going to check your pulses. We're going to first start at your neck, at the carotid artery. Then we're going to go to the brachial, bilateral, both arms, and both radial pulses. While I'm doing the radial pulse, I'll be checking your heart rate. Okay? Okay. All right. Being sure to press at the neck and not pressing too hard to feel the pulse. Okay? Then we're going to go to the brachial artery. I'm going to do both. Feels good. Check the distal radial artery, one's furthest away from me. Then I'm going to come over and check the one that's closest to me while checking her pulse for 1 full minute. I'm checking for rate and rhythm. Are you okay?
Yes.
Always checking to make sure that the patient is okay and there's no discomfort involved. Okay, pulse is 72. All right. So now I'm going to check for your lower extremities to make sure that you have good pulses there also. I'm going to feel behind both of your back, both of your knees, and at the top of your foot. at your great toe. Okay, just relax. All right. Okay, everything feels good. I'm going to check your skin turner. When I'm doing that, I'm going to pinch your fit at behind your hand, and I'm going to pinch at your leg. Okay, we do that to make sure that your skin pops back into place. Okay, I'm also going to check for swelling. Have you had any problems with swelling? No, ma'am. The arms and legs and the hands and feet. Everything feels good. While I'm doing that, I'm checking her skin, checking for warmth or coldness on the skin. Now I'm going to check your fingers. I'm checking your capillary refill. I'm going to press on the finger to see how fast the blood comes back to your finger. Okay? Okay. It doesn't hurt. 2 seconds. The other hand. 2 seconds. Going to check the toe. 2 seconds. Other toe. Okay. Everything looks good so far. All right. What was your last bowel movement? It was this morning. Okay. Any problems with your bowel movement? No. When was the last time you urinated? This morning. Did you have any problems with urination? No, ma'am. Okay. The next thing I want to do, I'm going to listen to your bowel sounds. First, I'm going to take my stethoscope. I'm going to have to pull down or go into your belly so my stethoscope can touch your skin directly. I'm going to check all four quadrants, upper and lower, to hear your bowel sounds. Okay? Okay. It's going to be a little cold. Okay? You're on. For t- purposes, I'm not going to pull her clothes down because we're not supposed to disrobe our patients. But normally, I would not check her bowel sounds without it touching her skin. Good. Okay. I'm going to have you sit up on the side of the bed for me. I'm going to obtain a weight on you. But first, before you get up, I want you to sit down there for a moment because I want everything to flow good. So we won't have any problems with you standing up. But I don't want you to have any dizziness or anything like that. Okay? I'll get the scale. Okay. How are you feeling? I'm feeling good. Okay, stand up for me. While she's standing, I'm checking to see that she's standing evenly. She's not dizzy or moving from side to side. How her posture is, her shoulders to see if they're aligned, if her feet are aligned, to make sure there's nothing happening. She seems to be good. All right, ma'am, could you please step on the skin for me? Assisting the patient at all times to make sure that she does not fall to the side or hurt herself in any way. Always keeping a hand nearby. All right, let's take you away. Can you step back for me, please? Okay, you can have a seat. All right. Her weight was 110.6. All right. Get back into the bed now. I can help you. Oh, sorry. And By watching her get into the bed, I can see that she doesn't have any pain, or she's not grimacing or showing any facial expressions or expressing any discomfort whatsoever. Okay, Miss Rowland, that's the end of my assessment. What I'm going to do is document before I leave your room. I'm going to place everything back into your reach as far as the remote, the phone, and the call light. If you need any assistance, please don't hesitate to call. If you're dizzy or have a headache, please don't get out of the bed with some assistance. At this time, I will brace the arm rails, which were down when I came in, and to provide security. Okay, would you like a blanket, ma'am? Yes. I'm making sure that I put the room back into the same condition that it was when I got here. And once again, thank her for letting me assist her. Thank you very much, ma'am. Have a pleasant day. You too. Thank you.